Good evening, and thank you again, everyone, for joining us. The topic for tonight is 8 nutrients for pregnancy. And as we know, nutrients are very critically important for fetal growth and development. Also, it can help to improve the outcome of your childbirth. It's critically important for your baby's growth after your baby is born. And also, it can improve the health of both mom and baby. So, tonight I am so excited to have a fantastic guest, Dr. Steve Chaney, who's going to be with us tonight. Dr. Chaney comes with an incredible background to help us with this topic. He received his BS degree in chemistry from Duke University and his PhD degree in biochemistry from UCLA. He is currently the professor emeritus at the University of North Carolina at Chapel Hill. Dr. Chaney is an educator, he is a scientist, he is an author. He taught as an educator, taught human metabolism and nutrition. So he really knows what he's talking about to all of the first year medical and dental students for 40 years. He was named the Basic Science Teacher of the Year and also received Excellence in Teaching Lifetime Achievement Award. As a scientist, he ran an active cancer research program for 37 years, and he's internationally known for his research for biochemistry of anti-cancer drugs. As an author, he has published over 100 papers, 12 reviews in peer scientific journals, and he's also done 2 chapters on nutrition for 6 editions of textbooks that are used for medical students. In his teaching of medical students, he realized that nutrition can be a lot of mumbo jumbo that people really don't understand. And so what he's done is to do what's called a weekly, I believe it's weekly, online presentation for health tips from the professor. Dr. Chaney also has 2 books that can be purchased on Amazon, Slaying the Food Myths and Slaying the Supplement Facts. So, Dr. Chaney, we are so excited that you're with us tonight and look forward for some of the gems that you're going to share with us about nutrition and pregnancy.
Well, thank you, Carolyn. If you pull up the presentation, we'll go ahead and get started.
That sounds good.
Okay, so there are 8 key nutrients for a healthy pregnancy, and I've got a little color code here. So the ones that are in black are ones that are generally present in adequate amounts in just about any prenatal. Not all prenatals, but most prenatals. The ones in red, though, are a little bit more iffy. So the ones in black are low in our diet, but present in prenatals. The ones in red are low in our diet, but they're also low in prenatal supplements. So those are the really problematic ones. So let's start with folate, folic acid, whatever you want to call it. It's associated with devastating birth defects. The most widely known is neural tube defects, where the nerve actually that's supposed to be in the spinal cord actually escapes the spinal cord and just bulges out, sometimes right through the skin. These babies very seldom survive for long.
Yes.
Now, 67% of women don't get enough folic acid or folate from their diet, and most prenatals contain folic acid at the recommended level. So prenatals are good with folic acid, but you have to take them.
Yeah.
Iron deficiency. So iron is a big one. It can cause anemia in the mom, but it can also cause cognitive and behavioral issues in the child. So definitely something you want to avoid. 40% of women don't get enough iron from their diet. And again, most prenatals contain iron at the recommended level. You just got to take them. Vitamin B12, it's another fairly common deficiency. It's associated with anemia, but it's also associated with preterm births and miscarriages in the mom and cognitive and behavioral issues in the children. Now, 5 to 15% of women don't get enough from their diet. That looks like a low number, but if you happen to be vegetarian or vegan, you're much more likely to have not gotten enough vitamin B12 from your diet.
Yes.
But once again, most prenatals contain vitamin B12 at the recommended level. You just got to take them. But then we get into some nutrients that are more problematic. Vitamin K. So we know vitamin K is essential for healthy bone formation, but it's also essential for blood clotting. So vitamin K deficiency is associated with excessive bleeding during both birth and recovery for the mom. And of course, if you're severely deficient, the child may have trouble with their bones.
Wow. Mm-hmm.
Now again, 40% of women don't get enough vitamin K from their diet. Now here's the deal. Only 31% of prenatals actually even contain vitamin K, and only 16 meet the daily value recommendations. Daily value is the standard set by the Institute of Medicine, the National Academy of Science. This is what we use to measure the adequacy of nutrients with. So only 16 meet the DV recommendations. So now you've got to read labels. You've got to choose wisely. You'll see the percent of the DV on the label. Iodine. Here's one that not so many people expect, but that's relatively recently we discovered that iodine is also important for fertility, brain development. Iodine deficiency can reduce your chance of conceiving, but it can also, in the child, lead to problems of cognitive development, reduced IQ, and school performance.
Wow. Wow.
So again, it's very important. 40% of women don't get enough from their diet, but the average prenatal only supplies 50% of the daily value for iodine. So once again, you got to read labels. You got to choose wisely. Now, the other nutrients are what we call bulky nutrients. So for bulky nutrients, you should fill the gap. Now that picture, if you can see it, you may not be able to. That's from the London subways where they tell you mind the gaps so you don't, when you're stepping out of the subway, you don't get your foot caught in the gap between the subway and the platform. But it's a little bit similar here. So with bulky nutrients, you can't get enough of them into a prenatal capsule or tablet. So what we really recommend there is to look at what the requirement is, but also what the average American woman is getting from her diet. So the gap is what's in between those two, what's in between recommended and what the average woman's getting from her diet. So that amounts to around 458 milligrams for calcium, 272 milligrams for choline, around 200 to 300 milligrams for the omega-3 fatty acid DHA. So let's talk about those now. Calcium, again, is absolutely essential for bone formation. In medieval times, because we didn't know anything about calcium, we didn't know that dairy was needed or that sort of thing. Back in those days, the saying was a tooth for every baby. So basically, the baby will rob calcium from the mom's teeth and bones. So they lose a tooth or two for every baby they had.
Wow.
And calcium deficiency is also associated with preeclampsia, which is high blood pressure. That can be very serious in a pregnant mom, and preterm birth. So here's the deal. 90% of women aren't getting enough calcium from the diet. Now remember the gap. What you need is about 458 milligrams. The average prenatal only supplies about 270 milligrams. So again, you got to read labels. You got to choose wisely. Choline. So choline is, again, fascinating story here. And it's actually a scientist and teacher and actually head of the nutrition department at the University of North Carolina for a number of years, Dr. Steve Zeisel. He was the one that really brought this to the fore and proved that choline is essential for a healthy pregnancy. It's important for placental function, for neurodevelopment of the fetus, for fetal growth, and for chronic disease risk in the children.
You don't hear much about choline. That's
And
not.
choline, that's because, these other things have been around forever.
Mm-hmm.
Choline's been around. Well, it's been recognized as essential for healthy pregnancy probably for 30 or 40 years now. So it's not like it's completely unknown, but yes. But 90% of women aren't getting enough choline from the diet. If you want to fill the gap, you're going to need about 272 milligrams. The average prenatal only supplies you 25, less than 10% of what you need for a healthy pregnancy. So again, you have to choose wisely. And finally, DHA, it's a very important omega-3 fatty acid. And we're talking about omega-3 fatty acids. We always talk about EPA and DHA. Both of them are important, but DHA is particularly important for brain health. It's part of the sheath, the covering of every nerve in our body, particularly in
Wow.
our brains.
Wow.
So, particularly that developing fetus needs a lot of DHA. It's essential for brain development and eye development. It also can help prevent preterm labor, low birth weight, and helps to support postpartum mood. So, postpartum depression can be a real issue.
Yes.
DHA can help you avoid that. 95% of women aren't getting enough from their diet. Remember, you need about 200 to 300 milligrams. The average prenatal only supplies 94 milligrams.
Wow.
So again, you got to choose wisely.
Yeah.
Now, one thing that's really interesting, one study recently compared prescription versus non-prescription prenatal supplements. Now, why that's important, if you go to your doctor and ask what they recommend, it's almost always going to be a prescription prenatal supplement. But when
Mm-hmm.
these were compared head to head, the prescription prenatal supplements contain fewer vitamins, fewer minerals, significantly less vitamin D, iodine, and calcium than the non-prescription prenatal supplements. So the one your doctor recommends may not be best.
Hmm.
So 7 tips for choosing the best prenatal supplement. Don't rely on health gurus' recommendations. There are tons of health gurus on the internet. They all have their prejudices. Don't believe the manufacturer's claims. There's a lot of baloney that you see in advertising the products.
Yes.
Don't even assume your doctor's recommendation is best. Look for a prenatal that contains all the key nutrients for a healthy pregnancy in the right amounts. And look for prenatals that have 100%. So what are the right amounts? 100% of the DV for all the nutrients, except for the bulky nutrients. And prenatals that fill the gap for bulky nutrients. And then avoid the excesses. There's some prenatals out there that provide thousands of percent of the daily value for some nutrients. That's Russian roulette with your kid.
Wow.
We
Wow.
don't want to be getting potentially toxic amounts of some nutrients. So those are my 7 tips for choosing the best prenatal supplements. As Ben Franklin said, an ounce of prevention is worth a pound of cure. And for the expecting mom, that's absolutely true.
Well, Dr. Chaney, this is a lot of really critical information. And even when those vitamins were including what was needed, you mentioned, but you have to take them. And I just know that for many women, there's a point in which they even don't want to admit. And I would just say, okay, I mean, if you're not taking your vitamins, just let us know. Let's see what we can do to help with that. Um, I know that taking the prenatal vitamin, it's such a large tablet, can be very difficult. So that's the challenge. I mean, you can contact me, and for those who are listening, I have done an evaluation of all the different prenatal vitamins, a large number that are on the market that are available, and I'd be happy to share that. But the big thing is taking it, and even when taking it, it's still not 100%. So that's something.
Absolutely. And, Sometimes cost is a factor.
Yes,
Sometimes people just don't like to swallow the pills. There are all sorts of things that can go into that choice. But I just remembered, I just want to stress that it's your child we're
yeah,
talking about. Some of these things were issues with the pregnancy and delivery, but we're talking about the health of your child.
exactly.
So, a little bit of extra cost, inconvenience of a large tablet, whatever it is, that pales in comparison to having a healthy child.
It's interesting. Not It's interesting with that because I know that you also talked about the long-term effects for mom, the long-term effects for the infant. A lot of attention is paid to the 1,000 days, meaning the point of conception all the way to about 2 years of age, as that being a very critical time for fetal growth, development, and actual growth of the child. And so you brought forth a number of things, a number of key nutrients that are not only laying, well, you talked about DHA, how critically important that is for all the nerves, like the coatings for all the nerves. There's a lot of information that you shared that we don't know. And I think what mothers understand, not only mothers, dads, families understand how critically important this is, that they will really sit up and think about this and probably start doing some comparison as to what's available. So I,
Yeah, and I think that first 1,000 days is important because a lot of these same nutrients are still important once the baby's born. I
yes,
mean, it just rips my heart out when I see a mom with a kid, an infant in their stroller, and they've got something like Pepsi or Coke in their bottle.
yes, yes, yes. And we're going to also move into breastfeeding soon. This is a great primer for that because the same nutrition that's required during pregnancy, you're laying down the foundation, and then breastfeeding is just continuing on with that. I have supported many women, even women who've had preterm infants, with breastfeeding. And also, I remember there was a scare about the availability of formula. Can you imagine? And that if we understand how critically important breastfeeding is, how that's providing crazy nutrition for the baby, and how the milk changes as the baby changes and grows and develops. So, Dr. Chaney, thank you so much again. We really appreciate the time. Also, for those who are trying to understand, there are 2 books you can get on Amazon. Slaying the Myths of, I'm trying to get let me just look for 1 second.
Slaying the food myths and slaying the supplement myths.
Yeah. So, and also the Healthy Tips from the Professor. I have really enjoyed reading that. Dr. Chaney is able to give you good information without the hype, just as he gave a really great, very succinct presentation on these 8 essential nutrients. That's how his Healthy Tips from the Professor are, and that's something that you can also subscribe to. I'll include that information in the description of this video. But once again, Dr. Chaney, thank you so much. We really appreciate it. Thank
Well,
you.
thank you for the invitation. Glad I could do it.
Yes, thank you. Good night, everyone.